Yo, yo, yo. My Nightbot is tripping. So I set up all these custom commands and they is tripping. What's going on, chat? This is Dr. Cheapest Sunflower. Back with another video. How y'all feeling on this beautiful, beautiful day? As you can see from the title, today we will be talking about teeth. Okay, this is exclusively for teeth. Oral Hygiene 101. Hello on Twitch. Hello Facebook, YouTube, and where else? TikTok. I can see all of my comments. So come on in the room to the Hood to the podcast. This is day 7. And I am going to be discussing nothing but teeth today. Okay? So if you have questions, go ahead and drop your questions in the chat. Go ahead and drop your questions in the chat. I've been checking in on Streamer University this weekend, and it's been really, really cool. Super duper cool. I've been learning a lot from the outside looking in. How can I? Oh, okay. There we go. What's going on, chat? Happy Sunday, guys. So welcome back to the Hood to the podcast. This is your host, Dr. Cheapest Sunflower, and we are here to talk about Oral Hygiene 101. This is a podcast where we bridge the gap between the streets and the suites. I'm Dr. Sean, your neighborhood dentist. Here to drop some knowledge on how to keep your teeth and your mouth healthy and your smile shining. Today we are diving into Oral Hygiene 101, breaking down 25 crucial tips across 5 key areas: flossing, tongue care, dental decay, dental anxiety, and we will test your dental IQ. Just as a side note, I am on day 7 of the consistency challenge. So it has been exciting. Growing every single day. So y'all come on in the room, support the chat, engage, drop some comments, tap the hearts, no matter what platform you're on. Tap, 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 tap. Tap, 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 tap. And if you are on Twitch, go ahead and hit that follow button. I'm still trying to reach my goal of 10 followers on Twitch, which is a challenge. As you know, it's one of the hardest challenges I've faced on any social media platform. So if you have the platform, go ahead and drop Dr. Shizzy a follow. All right, it will be greatly appreciated. Thank you in advance. And I appreciate all my other followers on Facebook, YouTube, TikTok. Go ahead and download the Twitch app and follow me. And if you are an Amazon Prime member, you can subscribe to my channel for the free. I don't know what's up with my Streamlab, with my Nightbot. At Streamlabs, questionable judgment. Stop posting links. Warning. My Streamlab is tripping. What up, Clifford 2000 fan? How you feeling on this wonderful, wonderful Sunday? So I have been pretty busy today, just, semi-busy, I would say. Doing some paperwork. I had a meeting with one of my pageant girls. I was interviewed by one of the pageant girls from the Drifters Incorporated of Tallahassee, Florida. They nominated me as a Woman of Excellence for the 6th annual Little Miss Drifters Calendar Girl pageant. So, yay! Thank you, the Drifters, for that nomination. I really, really appreciate it. If you are in Tallahassee, you can support this event, Tallahassee, Florida. You can support the contestant, Ashley Barnes, which is a pageant contestant. If you want to know how, you can email me for more information. But yeah, that's what I've been up to today. She has some really, really good questions for me. And one of her questions was, what advice would I have for someone who is like in elementary school, or this thing in my ear is so irritating. Let me just turn this down a little bit. So yeah, her question was, what would I recommend for a young adult? And I just say, if you're young, the best thing that you can do is learn to love yourself when you look in the mirror. Because, you know, kids get bullied and school can be a harsh place sometimes. So that's one thing, is to love yourself. Be unapologetic and always be in pursuit of your goals and your dreams. You're going to always find me talking about pursuing your goals and dreams, because I feel like a lot of people don't do that. It seems like it's common, but it really ain't that damn common. It really ain't. It's really not that common. So I am here to be your reminder, chat, to pursue greatness at all times. Okay? So let me get a vibe check. Drop some emojis and let me know how you feeling. Do an emoji talk. What emoji describes you today? Let me tell y'all what emoji describes me today. Let's see. I'm gonna pick 3 of them. I got the cool shades on. I got the spa and the rose because I'm chilling like a villain on a Sunday. And you know, I'm always busy and a rose growing through concrete. What's that faint music playing in the background? Is that from the radio? Nope, that is my playlist. That is my podcast playlist. That's my background music. Is this the one that I really like? Let's see. Clifford 2000 fan put a happy face 100 thumbs up. Okay. Sunglasses. Those seem like positive vibes to me. If you had a theme song, what would it be? Right now, my theme song is Affirmations by Flipper T. I said Flipper T. It's Flipper T. Flipper T. That would be my theme song. I thought it would be Judo Flip. That's your theme song, not mine. Yeah, my theme song will be Flipper T. Affirmations. That's my song right now. Like today, that is my theme song. Like, because that song describes coming from the hood and being hooded perfectly. It has a lot of ratchetness in it. It has a lot of like motivation in it. It's about affirming yourself. It's just so hood. Like, I love hood music. I'm a Florida girl. How can I not? Then my high school, we was all about hood music. Michelle Baranski has liked the stream. Yay! Thank you, Michelle. Vibe check. Let me get some W's in the chat. W, positive vibes only. Dang, my night bot is tripping on Streamlabs. I got too many bots in my chat. And one is stopping the other one. I said something wrong, y'all, because it's like, what is going on? Okay. But anywho, this is Oral Hygiene 101. Um, and our first segment is talking about flossing. Hey, you gotta floss to be the boss. Hey, you gotta floss to be the boss. Hey, you gotta floss to be the boss. Nightbot is tripping. Yes, Nightbot is tripping. I need to disable it because it's doing too much. So just ignore the Nightbot. Ignore the Streamlabs because I said something up wrong, y'all. I said something up wrong. Don't worry about it. Yeah, I said that all the way wrong. Oh, I got another alert. What is this alert here? Dang, I need to move my alert. Dang, I missed that alert. So yeah, our first section is talking about hello, flossing. Flossing, the unsung hero of oral health. This is so important. How many of you guys are flossing every day out there? I'm about to take this out of my ear because it's like distracting me. It is such a distraction. Such a distraction. Oh man, I'm doing something wrong here. Dang, what did I do? Oh crap. Okay. You floss awesome. Hopefully everybody is a flosser. So flossing is the unsung hero of oral health care. Okay? Flossing is the unsung hero of... I gotta take that down. So let's start on the culprit of flossing. So flossing daily is essential to your overall health. So if you do not floss, this is your message and your warning. You have been warned that if you do not floss, you will have repercussions. You will have lots of them. Only 32% of adults floss daily. That number is very low, but it's probably even lower than that. Yet flossing removes plaque and food particles from between your teeth that brushing misses. All right? So neglecting to floss can lead to gum disease and cavities. Okay? Gum disease and cavities if you do not floss. So we already know how many percent of adults do not floss. 32% do not floss. So 1 out of 3 of you guys watching this probably floss. The other 2/3 don't even care and don't even know why it's so important to floss. My favorite game shows are Jeopardy, Wheel of Fortune, and Who Wants to Be a Millionaire. Those are good for the brain. They make you think. What is my favorite game show? I like Family Feud. I don't really watch game shows that much. When I was younger, I would definitely say Wheel of Fortune, only because my grandma watched it, so I didn't have really a choice to watch it. But I don't really watch too many game shows. All right, but flossing is super, super important. So make sure you guys are flossing so you are not in that higher percentage of people who don't even understand why they should be flossing. Flossing isn't expensive. All you can do is go to the Dollar Tree, pick up you some floss. Well, I don't know if it's $1 anymore. It's probably like $1.50. And who knows with these tariffs, but we ain't talking about that today. We just talking about flossing. So flossing is the unsung hero because most people only do the one step when they do their when they do their oral hygiene routine. They only got the one step. But you know, when you got the one step, that means you can't really dance too good. You got to have a little two-step in there. Hey, you got to do the two-step. You got to floss and brush. Floss and brush. Floss and brush. Floss and brush. Hey, floss and brush. You get it? Get it? Awesome. Floss and brush. Floss and brush. Number 2, flossing prevents gum disease. Why? Because when you don't allow food and bacteria to cake up between your teeth and, sit on your teeth for long periods of time, you can have a healthier oral cavity. But if you do not floss and you allow, that taco or that hamburger to form a little house between your teeth, guess what's going to happen? You will lead yourself to having gum disease, inflammation. Sometimes this can be very painful when your gums are infected or if they're inflamed. Have you ever had a sore spot in your gum from just like not brushing properly? Those can be so irritating. It kind of impacts your whole entire life. This one little spot will take all of your attention away from everything that you have going on because oral health care and dental pain is nobody's friend. So take it from me, flossing prevents gum disease. Plaque buildup from not flossing can cause gingivitis, inflammation of your gums, leading to swollen, bleeding gums, and eventually periodontitis, which is bone loss. And you need bone to support your teeth, okay? If you got any questions about flossing, now is the time to put it in the chat. All right. Number 3, flossing reduces bad breath. So how many people are dealing with halitosis out there? You have some bad breath going on. You can't figure out why, but you aren't flossing. You walking around with 10-day-old chicken stuck between your teeth because you aren't flossing. Just like if you leave trash out around your home, or if you never clean your bathtub, or if you never wash the dishes, they're going to start to get mold and disgusting and have an odor. The same thing applies to your mouth. Your mouth has so many bacteria just naturally. But when you don't brush and you don't floss, you allow that bacterial load to grow and colonize even more. You allow that bacteria to start to form colonies, calculus, and it destroys your oral health. Okay, so flossing is the real T. Okay, people talk about what's T. T is flossing your teeth. Okay, I'm gonna need you to do that every single day. I have patients and they always, Dr. Sean, I gotta do better. I have to do better. Yes, you gotta do better. We all have to do better with our flossing. Because if we don't floss, we leave ourselves open to gum disease. We can spend hours and hours strolling on Facebook, strolling on TikTok, strolling on Twitch, all on YouTube, watching this TV, watching that. But are we spending that time investing in ourselves and taking our oral hygiene seriously? You can do Facebook all day, but all it takes is 1 or 2 minutes of your time to floss. I need you. That's all it takes. This is going to prevent gum disease. This is going to prevent halitosis. This is going to prevent a lot of money coming out your pocket if you don't learn how to floss. Because guess what happens when you don't floss? You get a buy one, get one free cavity. I know we like buy one, get one free at the grocery store, but we do not like buy one, get one free at the dental office. Two opposite things. Because when you get a buy one get one free cavity, this is a cavity that is between your teeth because you are not flossing. So you leave that area between your teeth stuck because you're not separating it. This allows the bacteria to ferment whatever you've been eating, whatever sugars you've been eating. They produce acid and it breaks down your teeth. And your teeth become soft. Now, if you know about enamel is the hardest substance in the body. But the acid produced by these bacteria, if you have poor oral hygiene, they destroy your teeth, and this leads to localized infections and possible systemic infections becoming worse. So you want to be careful. It can cause abscesses, pain. It can be the worst. All because you won't floss. I'm not fussing. I'm just saying, y'all. I'm just saying, like, we got to get it together. We got to get it together, my Niji. Flossing protects your heart. Did you guys know that? Flossing protects your heart. Can I get some hearts in the chat? Let me get some hearts in the chat. Come on, don't be shy. Let me get some hearts in the chat. Hearts in the chat. Because guess what? Flossing protects your heart. Poor oral hygiene, including not flossing, has been linked to an increased risk of heart disease due to the bacteria entering your bloodstream. Did y'all know that? So the bacteria that you do not get rid of every day enters your bloodstream and causes damage. It causes damage, guys. We can't be having that. We can't be having that. We can't be having that. Clifford, heart, maybe it did something to your face, red heart shape. Yeah, my Nightbots is tripping. Nightbots timed out Streamlab for 60 seconds. Boy, my Nightbot is tripping. Really, really tripping. So yeah, flossing has been linked to protecting your heart, I would say. If you don't floss that bacteria, yesterday we looked at spirochetes and we also looked at fusobacteria, those ones that look like worms that get out of control and can cause trench mouth. Y'all remember those pictures that we saw yesterday, right? So those same bacteria can travel to your heart. My mom was heavy on the oral hygiene. She's not a dentist, but she stresses frequent brushing. She didn't want us going to the dentist. Thank God for your mom, because some parents don't even enforce this for their children, and they set them up for failure. This is another generational curse when you're coming from the hood. A lot of people who grew up where I grew up don't even floss because we weren't taught to floss. This isn't something that we was taught. Okay, you're probably hearing this for the first time, some people. Hearts in the chat. Thank you, Clifford 2000 fan, for participating. I appreciate it. I choose a different heart emoji from YouTube and it came out as text. I was wondering what that was about. Yes, protect your heart by flossing today, my Niji. So let's look up. Before we move on, I want to show y'all something. Let's go to this video. So who wants to dance? Stop posting links. Oh, my night bots arguing with each other. It is kind of crazy. I really gotta fix that. I don't know how to fix it, but I'll fix it when I get off of here. So let's look at this video that I found. Let's look at this video that I found about heart disease. Dang, I'm gonna have to trash that one and do it all over again, because I want y'all to really understand how important flossing is. Okay? So let's check out this quick video. Quick video, guys. Let's go. Let's go back. Alrighty.
So my research is focused on the study of how bugs colonizing the human body, mainly bacteria colonizing the lining of cavities, how those bacteria interact with the lining of cavities like the mouth, and how they can shift to become pathogenic. And they become pathogenic by causing disease in the mouth, but also by causing disease, by causing inflammation systemically around the body. And that systemic inflammation is essentially really what drives the link between orobacteria and the plaques that build within vessels that then cause heart attacks, essentially. A specific bug which colonizes the mouths of healthy individuals, but increases in numbers in patients who have gum disease. It's called Porphyromonas gingivalis. It's very well studied for its incredible abilities to hijack the immune system, very sophisticated ability to hijack the immune system, and is really been a prototype for understanding how bacteria can evade the immune system.
Alrighty, so that was just a video talking about P. gingivalis, the bacteria that cause periodontal disease. So you can kind of see how that bacteria travels from your mouth to the heart and weakens your immune system. I think I missed one comment somewhere. I don't know where it was. Let's see. Hello, Swift. How are you today? How are you guys doing today? Welcome to the chat. Y'all can see I really struggle with all the technical difficulties, but it's gonna be okay. It's gonna be okay. All right. So more about flossing. So your flossing technique matters. You want to use about 18 inches of floss. Gently slide it between your teeth, curving it around each tooth in a C shape to clean beneath the gum line. All right, chat? So how you floss is important. A lot of people use floss plackers, and those are okay too, but you still want to make sure you're curving the floss around the tooth to remove the plaque. If you do this inadequately, the plaque can turn into calculus, which requires a dental profession to remove it from your teeth. I did show a video of, a picture of calculus yesterday. So it can get pretty extreme when you're dealing with calculus and not flossing. So I'm going to show you guys examples of extreme calculus when you don't floss. I'm not doing this to scare you. I'm just doing this to, let you know how serious this can get. Severe dental calculus. And drop your questions in the comments. Let me know, if what I'm saying is making sense. So we're going to look at some extreme cases. So if you have a weak stomach, this might not be the live for you. But if you are not a flosser, this might be the perfect live for you. Okay? So these are some pretty extreme examples of calculus. When you don't floss, this is what can happen. And some people might be like, oh my gosh, I can't believe this is what can happen. But these are pretty extreme cases of what periodontal disease looks like when you start to lose the bone around your teeth, when you forget about flossing, when you just say, fuck brushing my teeth, I'm just gonna let it go. So this is what you can expect to happen when you just say, I give up and I don't want to brush. Okay? I like this little slide here talking about calculus, mineralized plaque. So remember I said if you don't floss the plaque off, within a day or two, it starts to calcify. And the average time for detectable calculus is 12 days. So when you go longer than 12 days, it can get pretty bad. It can get pretty bad. Starts as a pellicle, then you get plaque, biofilm, and then mineralization where it gets really hard. This can be beneath the gum line, which is called subgingival, or this can be above the gum line where you can see it up here, which is supragingival. And it ultimately leads to this, tooth loss. That's what it leads to. And you can see how the plaque in the calculus, or really the calculus, causes the teeth to stick together. Alright, so that's why you want to kind of brush your teeth. These are extreme forms of periodontal disease. If you were like, man, Dr. Sean, I ain't flossing, I don't care what you say, well then, this is your future. Congratulations. And if you already at this state, you have to get this calculus off of your teeth ASAP, because it's going to lead to decay, extraction, bone loss. Now, when we talk about protecting your heart, right? We talk about protecting your heart from this biofilm. These pieces of calculus can break off. The bacteria can go to your arteries, cause plaque buildup, and put you at a higher risk for heart disease because this bacteria enters your bloodstream. So you want to keep the bacterial load as low as possible by brushing and flossing every single day. Okay? You got it, guys? Let's take this picture off. Let's take that picture off. So we're moving on to our second segment, talking about tongue care. Whoop, whoop, whoop. Somebody had a question. Okay, let me check out this question first. If you got a question, drop it in the chat. Let's see. I see a question. What company makes Clifford 2000 fan? What company makes the best toothpaste, mouthwash, and electric toothbrush? That is a multifaceted a question. It really depends on personal preferences. Toothpaste is toothpaste. It all depends on what you like. Do you like flavor? Do you want a little fluoride in your toothpaste? Are you more holistic, so you don't want anything but organic ingredients? It all depends. I love Sensodyne. Not because Sensodyne sponsors me. Hint, hint. Sensodyne, I need y'all to sponsor me. But I love Sensodyne. Well, they do send us toothpaste to the office for the patients, but that's beside the fact. I like the Rapid Relief Sensodyne because I did whitening once and it made my teeth slightly sensitive. So the Sensodyne Rapid Relief prevents sensitivity from cold. It protects your teeth, and they have so many different brands that based on your current health condition. A lot of my patients, I recommend Parodontax because it's good for younger teenagers. It helps with bleeding gums, and it helps you keep your gums healthy. So Sensodyne would be my brand. If you're looking for something more organic, there are hundreds, well maybe not hundreds, dozens of different brands out there. And everybody has a different toothpaste. So just find something that you like. Some people like flavor. Some people like different things. Now, if you have an oral health care condition like what I just showed you, those toothpastes are not the best for you. You may need your doctor to prescribe you a toothpaste like Clenpro, something with a little bit higher fluoride content so that it can kind of reduce the inflammation and help you get a healthier oral cavity. Hi, Sut Lacey. Yes, I am a doctor. I am a doctor of dental surgery. Whoop whoop. All right. Great question. And the other question was mouthwash. I like Act mouthwash, but again, the mouthwash is going to be based on your current oral hygiene. There are some mouthwash that are for conditions like what we just saw, like Paradex. They have antibacterial properties which will help alleviate some of this inflammation and irritation that you might get from having periodontal disease. Okay? Toothbrush. Electric toothbrush. My favorite electric toothbrush is gonna be the Oral-B iO spin brush. I prefer the spinning versus the Sonicare. So electric toothbrush is always gonna be the best toothbrush in my opinion. Some patients have sensitive teeth, they have wiggly teeth, They don't like the feel of the electric toothbrush, but it is very important that you kind of use an electric toothbrush. It's going to be able to remove plaque and film, the biofilm, a lot faster than a manual toothbrush. So I always recommend an electric toothbrush to my patients. What do you suggest for former smokers? Former smokers need to go see a dental professional just to make sure you do not have any signs of oral cancer. Also, if you are a former smoker, you probably have periodontal disease. So what a dentist is able to do is check between your teeth and the gums to see if you have any dental pockets, to make sure that you don't have any inflammation in those pockets, so that they can reduce that inflammation, reduce the bacterial load, and help you get to a healthier state so that you don't continue to lose bone, because the bone doesn't automatically regrow by itself. We can refer you to a periodontist who is able to do bone grafting and other different procedures to try to increase the bone, but those are, specialized procedures based on the mouth. So when you're a smoker, it all depends on how much bone you've lost. So we would need to do an x-ray to see how much bone you lost. Do you need a deep cleaning to remove any bacteria or inflammation in your pockets to get you back to a healthier state? So it all depends on how long you've been smoking and what damage the smoking has done. All right. What does mouthwash do for your teeth? Really, mouthwash is just like an added step to your oral hygiene routine. Mouthwash just kind of like finalizes it, rinses all of the bacteria out, but even though the bacteria is always there, it just kind of helps you reduce that bacterial load. For example, if you have periodontal disease like what we see here, and we give you the Periodex mouthwash, it's able to go into those small crevices and kind of help get rid of that bacterial load. All right. Act mouthwash. Some of these claim to have anti-cavity properties, but this is a liquid, so I don't know if these claims are really accurate. But for me, I feel like it's great to have an oral hygiene routine that does multiple things. Your oral hygiene routine should at least be 2 steps. But if you really want to save your teeth, you're going to do whatever you can. Some people do the brushing, the flossing, they use a mouthwash, they're brushing their tongue, they have a water flosser, they're going to the dentist, they're doing multiple things to try to save their teeth. Some people only doing the 1 step, and then they're not even doing that correctly. So the mouthwash, I feel, is a great benefit. All right. Another question. So the Oral BIO is an expensive toothbrush. The cheapest one is like $59, but these have a timer. They can let you know if you're brushing too hard, because some people brush too hard and they actually do damage trying to remove that calculus. Like I told you, you can't remove that with a toothbrush. You need a dentist to go in there and actually physically pry that calculus from your teeth, because it's almost as strong as Gorilla Glue sometimes. When I'm doing deep cleanings, sometimes it's very difficult to take it off, which is why we have to numb the patient in order to get it off so that they don't feel the pain, because it's not painless. All right. So these are the toothbrushes that I recommend. The Oral BIO, Oral B. I need y'all to holler at me. Sponsor. All right. I use a sonic toothbrush from a company called 7AM2M. Do you know anything about this company? I've never heard of that company. 7AM2M. 7AM2M. I think I spelled that wrong. Electric toothbrush. So you're talking about this toothbrush. I've never heard of that company. But once again, as long as you're brushing, that is the goal, guys. A lot of people get caught up in what to brush with, how to brush. The best thing that you can do is be consistent when you're brushing. Just like this consistency challenge, Brushing is not something that's negotiable. You have to do this every single day, twice per day. It only takes a couple minutes, but for many people, that is a very difficult commitment to brush and floss every single day. Most people get off of work, they're tired, they just want to eat, take a shower, and go to sleep. But remember, every night that you skip brushing and flossing, you risk your teeth having periodontal disease, okay? Never knew about bone loss. Yes, bone loss is severe. Sometimes you can have teeth that I would say healthy per se. Well, they're not healthy because they don't have bone, but they don't have cavities. But because the bone isn't there, you can't save them. And it can be painful. So I like this picture here. Let's go to this image. Uh-oh. Give me a second, guys. I think this will help us explain bone loss. This is kind of a scientific topic. But you can see two sides of the tooth. In case you were wondering, like, dang, I didn't know bone loss was possible with the teeth. Alright. Zach B, hey y'all, if you're enjoying this live, hit that like and share button. Yes, let's help Dr. Sean's message reach more people. Thank you, Zach B. I appreciate that. Brushing without flossing is like showering without your socks on. It's like showering with your socks on. Or it's like showering without soap or a rag. Just getting in the water and not going into any crevices. It's like just getting in the shower, letting the water hit you, and getting out. When you floss, you're actually going into the crevices under your arms, your legs, between your toes, behind your ears. That's the flossing. It's the detail that counts, because these details make a huge difference. Go ahead and pump those hearts. Go ahead and pump those hearts. Make sure you're following me. And if you're watching this, go ahead and follow me on Twitch. Even if you subscribe to me on other platforms, I would be grateful if you guys help me get to 10 Twitch subscribers. Let's get to 10, guys. I know I'll get there eventually, but you know, floss the teeth you want to keep, period. Hey, only floss the teeth you want to keep. I tell my patients that all the time. Now let's get into this image. So as you can see from this image, there are two sides to the teeth. There's a healthy side, and then there is a disease side, which is the periodontal disease. This is a disease in your mouth. A lot of people walk around with disease in their mouth every single day, and they don't think about it because it's in this little tiny space that most people don't see. But what happens when people start to get periodontal disease and bone loss and oral hygiene problems, they start to lose their confidence. And if those cavities and that issue becomes in the smile zone, then you'll notice that they talk with their teeth never showing, they're never smiling. You know, it has a big impact on your life. It really does. And you probably will never know, because those people talk maybe like this. They can't even smile. They don't even want to talk. It prevents them from getting jobs. It prevents them from taking pictures. They don't want to show up to the wedding. They don't want to show up to the graduation. They don't want to be out in the public because of their teeth. They can have everything else in their eyes perfect, but when it comes to the teeth, it is a serious thing. So on the, let's see, on the left side of my screen, you can see the healthy gums and bone. It has a normal pocket of about 3 millimeters. So when you come in, when you ask me about the smokers, how do we know what health your teeth are in? If you're a smoker especially, we would do probing depths. So we would take our little metal instrument, which has these measurements on it, put it into the pocket, which is the area between your tooth and the gum and the bone. And then we would take a measurement. And if it's 3 millimeters, that means it's, you know, in the normal range. But once it gets to 5 and 6 and higher than that, this is active disease sometimes. All right. And on the healthy side, you can see the gum tissue is pink. It's a nice color. You don't see any redness. You see the bone on the inside that's supporting the tooth, so that the root of the tooth is completely covered. The root of the tooth is completely covered. Let me get something real quick, y'all. Where is my widget? Where is my widget? I can't find it right now, so... Okay, scratch that. But anywho, so you can see the bone, the gums is healthy. Now let's go to the other side of the mouth. What differences do we see, chat? We see the plaque that we talked about, the biofilm, and the calculus on the tooth. This is a mild version, but you can imagine if it was those big chunks sitting there, this area is going to be a lot worse. But they only have a little bit of biofilm and plaque and calculus. It's starting to go beneath the gum line and separate that tooth from the bone. It's starting to destroy this bone over here. Do you see the area marked bone loss? It's starting to destroy that bone. Then you get inflammation. Your immune system starts to respond to this plaque and this bacteria build up here. Now you're in a state of disease in your mouth. This is the area that travels from your mouth to your heart and infects your heart. Lost my wisdom teeth years ago, not being wise. That's a funny statement. Many people get their wisdom teeth taken out just because they grow in wrong. I don't have my wisdom teeth. I had oral surgery before I went to dental school to have them extracted because I didn't want them to bother me in dental school. They were growing in like a train. All right. So yeah, that is how periodontal disease happens when you don't floss. All right, guys, got it? Great questions, by the way. I really appreciate all of the questions and all of the, engagement. So we're moving on to the tongue, the forgotten muscle. So what is the tongue's role, guys? The tongue's role. The tongue aids in tasting, speaking, and swallowing. It's home to thousands of taste buds and a significant amount of bacteria. So the tongue is very important. Also, tongue cleaning prevents bad breath. So flossing prevents bad breath. Cleaning your tongue prevents bad breath as well. Bacteria is already on the tongue, but if you don't clean it, it just builds up the same way that it can on the teeth, but a little bit different because the tongue is not a hard tissue. So the bacteria on the tongue can produce volatile sulfur compounds leading to halitosis. Regular cleaning reduces this risk. So make sure you're brushing your tongue. Okay? Make sure you are brushing your tongue so you won't smell so bad. Make sure you're brushing your tongue, guys. Okay, you can get the same biofilm on your tongue, which will cause you to have bad breath. How do you clean your tongue? You can brush it with your toothbrush, or you can get a tongue scraper. So brush it with your toothbrush will work. Or if you don't want to brush it with your toothbrush, you can get one of these. And I wouldn't spend a lot of money on it. You could probably get this at the Dollar General or something, but I should make a Amazon list with all of the things that I recommend for a good oral hygiene routine. So something like this. This is a tongue scraper. Tongue scraper. A tongue scraper. So if you have problems with halitosis and you haven't been cleaning your tongue, this may be something that you could add to your routine. Okay, brushing it with my toothbrush. That's how my mom showed me how to do it. Yes, you can use your toothbrush. That's perfectly fine. Or if you want to be fancy, you know what I'm saying? You want to be like fancy and stuff. You can get you a little tongue scraper or whatever. And I like the stainless steel because, it's not going to build up bacteria. But you must clean this. Make sure you disinfect this and clean it because that same bacteria you're scraping off, you don't want to go sit it on your counter. You want to make sure you clean it. All right. Tongue cleaning enhances your taste. Okay. Removing the biofilm from your tongue can improve your sense of taste. So if things aren't tasting their best, you want to go ahead and clean your tongue because if you don't, it can make your food taste like bacteria. Nobody want no bacteria flavor. What flavor is your food? Bacteria flavor. Because I don't brush my teeth or floss or clean my tongue ever. Okay, so make sure you are paying attention to your tongue and showing your tongue some love, man. The taste buds matter. So this is just the image of the taste buds that are dirty with bacteria when you don't clean your tongue. All right, you got the bitter ones in the back, you got the sour ones on the side, you got the salty and the sweet. So clean your tongue, guys. All right, what about tongue cancer awareness? We got some comments in the chat. That's a great question, Clifford 2000 fan. How do you clean your tongue? Brushing with my toothbrush. Yes, I don't use fluoride toothpaste. That is totally okay if you don't use fluoride toothpaste. As long as you use some type of toothpaste and you brush your teeth, okay? My thing is, we don't have to start with a 5-step routine. We can do the 1-step. And you can do the 1-step with whatever toothpaste you prefer. The key is mechanically brushing your teeth, guys. You want to just be able to get in there and brush your teeth. When you start to pick toothpastes and all of that, if you really want to know what's best for your teeth, have a dental checkup. And if you can't go to a regular dentist, find a dental school. Dental schools are a little bit cheaper. They do take a little bit more of your time, but it's going to be cheaper than going to a regular dentist. Find a health clinic that can give you a dental checkup. Okay? And ask that doctor, what is the best products for me to enhance my oral hygiene routine? Okay? So approximately 0.4% of men and women will be diagnosed with tongue cancer in their lifetime. So that's a very low percentage, but it's still possible. And you see how important the tongue is for eating, for talking, for swallowing. And without it, you live a shorter life. What puts you at risk for tongue cancer? Tobacco use is 1. Alcohol consumption is 2. And human papillomavirus. Tongue cancer is basically just oral cancer. And oral cancer can start anywhere in the mouth. But under the tongue is one of the primary spots where you can detect oral cancer. So if you have any suspicious lesions in your mouth that aren't healing, that aren't going away, you want to get this checked out ASAP. It can save your life, especially if you are ex-smoker, because people don't know that you can get oral cancer. I talked so much about oral cancer on this channel in April because that was Oral Cancer Awareness Month. So go back and watch some of those videos, but just make sure you are aware of this. Brings me to number 10, regular self-exam. So if you can't get to the dentist, self-exams, check under your tongue for any persistent sores, discoloration, or lumps. And consult a dentist if you notice any of these things. So what type of how would you know if you should consult a dentist? I'll show you a couple images of lesions in the mouth that you should be aware of. So a lesion like the one I have here, pulled up here. If you see something like this on your tongue or in your mouth, get it checked out. Let's see if we can find another one. A lesion like this one right here in the back. Get it checked out. And especially like the one I'm about to show you. Get it checked out. You see that? If you notice something like this on your tongue, save your life. Go and have it checked out. ASAP. Alright? You be mad at me. I have 2 cavities and 1 broken tooth. I definitely wouldn't be mad. Hello, Lucas, Shame Link. How you doing? No, I wouldn't be mad. At least you know that you have those issues, and hopefully you will eventually get those fixed before they turn into bigger issues such as extractions or tooth loss, which is what we don't want. People don't realize that when you have cavities, that's the cheapest form of fixing your teeth. Get the cavity fixed. Even if it's $200-300 out of pocket, you're going to spend that same $200-300 somewhere else. But guess what? You need these teeth. You might spend that $300 on some shoes, but guess what? In 2 years, those shoes are out of style. Teeth never go out of style. I need a shirt. Teeth never go out of style. They just never go out of style. Even when you're 100, teeth still gonna be in style. Even when you were in middle school, high school, teeth are in style. No matter what is your profession, teeth are in style. They're gonna always be in style. They never go out of style. So make an investment in your smile, whether that's repairing your cavities, whether that's invested in that tongue scraper, invested in that Oral-B toothbrush, switching up your routine, doing the 3-step instead of the 2-step, or the 2-step instead of the 1-step. You always want to think about your oral health because it links to the rest of your body. Okay? It links to the rest of your body, guys. Great questions. Great questions. And a lot of people, when they come to the dentist, they always be like, oh my God, doc, you're going to be mad at me. But I'm never mad at my patients because I understand achieving a healthy oral hygiene routine takes practice. It's not something that happens overnight. But I also say that to say this. I've had patients in their 90s with all of their teeth. I'm not talking about a few of their teeth. They had all of their teeth because they have consistency. And even when they're 90, guess what? The teeth are still in style. That same $200-300 you spend on saving your teeth when it's a filling, or even if you spend a couple thousand when it's a crown and a root canal, 20, 30, 40 years from now, you're going to be so happy that you saved that 1 or 2 teeth because they're priceless. You don't get a second chance. Yes, science is coming out where we can regrow teeth, but how long do you think that's going to take? And when they regrow the tooth, is it going to look like the same tooth, or is it going to look like some other tooth, or is it going to look like a mouse tooth? We just so far from that. Maybe it's here next year, but who knows? Okay? And Swift, I'm happy you mentioned cavities because that's our next Oral Hygiene 101 topic, which is dental decay. Understanding and preventing dental decay, which is what a lot of people suffer with, is cavities. What is dental decay? Tooth decay occurs when acid produced by bacteria, which I told you about earlier, erodes the enamel, leading to cavities. It's caused by frequent consumption of sugary foods, drinks, poor oral hygiene, and the lack of fluoride contribute to decay. So we got sugary foods and drinks, poor oral hygiene, okay? The lack of fluoride, it can lead to decay. Now we all know what tooth decay looks like. We all know what that looks like. We all know what that looks like. Tooth decay. Some people can look in the mirror and see some of these dark areas. That is decay. This is what happens when that bacteria that you're not brushing away builds up plaque and calculus on your teeth and produces acid that erodes your enamel. You're drinking those energy drinks, you're drinking that Coca-Cola, you're drinking those sweet teas, eating those Debbie cakes, and you not brushing it away. Because when you eating it, guess who else eating it? The bacteria. The bacteria eating right along with you. You're giving it to your kids to make them be quiet, but they're going to be screaming in pain if you don't allow them to brush those snacks off of their teeth. Dental decay. All right? Typical kids diet, sugary foods. Absolutely. But the thing about it, the reason why this is important for the Hood to Hooded podcast is because a lot of kids in the hood, again, they don't learn how to brush their teeth. They definitely don't learn about flossing because it's passed down from generation to generation. And people will say, oh, this just runs in my family. No, the poor oral hygiene habits run in your family. But you could pick up a toothbrush and floss and give yourself a chance. But if you don't even give yourself a chance, then yeah, it do run in your family. The lack of knowledge runs in your family. Decay is one of the most preventable diseases, but it's also one of the most common due to the lack of knowledge. Due to the lack of knowledge. We talk about baby teeth getting cavities. This is baby teeth right here with cavities. So you'll see some kids with a mouthful of silver teeth. This is because they have those big, deep cavities and they need baby root canals. So if you don't want your child walking around needing baby root canals and in pain, they can't focus at school, you got to go pick them up because their teeth are hurting, because kids' teeth decay just like adult teeth. And I know some parents might be like, well, they just baby teeth. No, baby teeth have nerves and pain just like adult teeth. And it hurts when you have a little child in pain for something that can be prevented. And most children have dental insurance. The parents just too lazy. Let's talk about it. The parents just too damn lazy to call the dentist to use their free insurance to get their cavities filled. Or they give them baby bottles full of juice and give their kids cavities. But it's due to a lack of education. And yes, this is a generational curse that must be broken. Not should be broken. It must be broken. We have to stop perpetuating these bad habits that lead to heart disease later. They lead to cancer later. They lead to, diabetes worsening. It leads to so many problems down the line when you don't instill these oral hygiene habits into your children. Think about how many adults can't even get it together. I have patients every visit, they always fall off. Dang, doc, I'm gonna do better, but they never do better because it's a habit. And the longer you go without getting this habit, the longer you put yourself and your family and future generations at risk for having tooth loss. And then you'll be that family saying, well, it just run in our family. Yeah, because you don't want to learn the knowledge. Okay, so the bacteria involved with dental decay is called Streptococcus mutans, and it's the primary bacteria responsible for tooth decay. So let's see what this bacteria looks like. Streptococcus mutans. Let's see what this little gremlin looks like. These are Streptococcus mutans. They cause that type of infection. Okay? Streptococcus mutans. So that's the culprit. You make people sound like they have no knowledge of dentistry. I don't. 90% of people, probably more than that, have no knowledge of dentistry. And sometimes as a dentist, I can think that, people know more than what they do. But being in this profession, seeing patients every day, just educating patients every day, it is one of the least talked about topics. Number one, because people will tell you, I hate the dentist. They don't mean it personally. They just be like, I hate the damn dentist. They don't like coming. They don't want to come for no reason. They think that everything that we do is going to be painful. And some of the things we do does cause a little bit of pain when we have to fix problems that already are causing pain. But with that dental anxiety, people just avoid dental education at all costs. And I get it. But a lot of people do not have this knowledge. So how do you prevent cavities? I'm sure y'all in the chat can tell me a couple of ways to prevent cavities. Somebody put it in the chat. How do you prevent cavities? Because I've been telling y'all this whole time how to prevent cavities. I want to see who has this dental knowledge to know how to prevent cavities, because I mentioned so many ways. So let's see who has been paying attention to prevent cavities. So drop it in the chat and then I'll tell y'all. But y'all should know. Or maybe some people don't know. And we can help them out. But dental decay it is connected to your systemic health. Poor oral hygiene is linked to systemic conditions like heart disease, remember? Diabetes, respiratory infections. So your lungs, your heart, and your blood. It's linked to all of that. So the healthier your mouth, the healthier your body. Okay, so you want to have this health is wealth goal. You want to go to the gym and work out. Make sure you working out that toothbrush. Okay, I see some answers coming through. The question is, how do you prevent cavities? Let's see what kind of answers we got in the chat. Okay. Let's see if I got one. We missing one more that I'm looking for. Who can guess what it is? Those some good answers, Clifford 2000. Even if you missed the earlier beginning of class, just put me some answers in the chat. How do you prevent cavities? How do we prevent cavities? Great answers, Clifford 2000 fan. He would be one of those 32% of people who are actually not avoiding the dentist. Great answer, Swift. Great answers, guys. So, Very good answer. It's one more that I'm looking for. There we go, Zach B. He got it. That was the last one that I was looking for. Very, very good. So let's see what you guys said in the chat about preventing cavities. Let's see. Clifford 2000 fan said brushing after eating sweets. Definitely. Brushing your teeth, especially if you eat a lot of sweets, you drink a lot of soda, you want to brush your teeth. You can wait about 30 minutes after eating those sweets so that you don't brush off, you allow the saliva to rinse away the acid and then you can brush, okay? Rinse with mouthwash. That is a great additive to your oral hygiene routine, is to rinse with mouthwash so you have that minty, fresh, clean. It's going to keep your tongue smelling fresh. It's going to go into those crevices and try to rinse all the bacteria out that you can and keep your bacteria load low. Flossing. We already know about flossing and how important it is to prevent that bone loss and to prevent that calculus from building up on your teeth like we saw earlier. Brush twice daily after every meal. Very, very good. That is one habit that people do not have under their sleeves. So brushing twice per day. Excellent answer. Rinse. Clean eating. Swift. Very good answers. Rinsing your mouth. Drinking a lot of water. And one word that you said is clean eating. Instead of eating the sugary foods and just trying to brush it away, you have to eliminate these sweets from your diet as much as you can. I'm not a candy person. Thank goodness I'm not a candy person. I do like chocolate, but I'm not like a hard candy person. I just gotta have sweets. And I don't know if I'm scared to get cavities, but I just stay away from candy, even though it tastes good. Sometimes you can't eat everything because a lot of the food destroy your teeth. What would you rather have, this piece of candy temporarily or your teeth for a lifetime? You got some decisions to make. And then the last answer from Zach B was the answer that I was looking for. Visit your dentist regularly. Listen to the instructions your dental health provider gives you. Perfect conclusion to preventing cavities. Because if you have these cavities, sometimes you don't know. It takes an x-ray for us to even see them when they're small. But if you wait until they're big and out of control, you're definitely going to need a lot more work than if you go and get those checkups. If you find a spot, you can fix it early versus waiting for a tornado to come, which is what people do when they avoid the dentist. They allow that anxiety to get worse and worse and worse. Then they go 5 years, 6 years, 10 years. Then it becomes never until they don't have teeth and they need a denture. I don't want that to be you, chat. So great answers. Very, very good answers. The next segment is talking about dental anxiety and overcoming fear. Okay? How many people out there are scared of the dentist? We just talked about this. Being scared of the dentist. How prevalent is dental anxiety? Approximately 36%, almost 1/3 of the population experiences dental anxiety, with 12% having extreme fear. I've had patients who have been extremely scared to just come into the office. But with this, you have to find an office that you're comfortable with, find a dentist that you like, and don't take no BS from no doctor. Because I know there are some mean ones out here who do not represent the dental profession to the highest quality of standards. They don't. They're mean. They give people anxiety. They're rude. Just because they have that white coat, they feel like they can be an a-hole. These people are already scared of us, bro. Like, pipe down. Pipe down. The drill. He said the drill has me terrified. Most people are afraid of the drill. But you got to find a dentist to talk you through it. Maybe use some earphones when you go to the dentist so you don't hear the drill. Make sure that you're numb. And also communicate with your dentist. If there's something that you're scared of that makes you uncomfortable, find a dentist that will listen and cater to that anxiety. Maybe you need some laughing gas. Maybe you need, some type of sedative to help you relax at the dentist. But if the dentist doesn't know, then they will not, you know, take those precautions with you. Zach B, there's no need to be afraid of the dentist. They are there to help you and take care of your smile. Absolutely. Absolutely. So causes of dental anxiety include previous traumatic experiences, which is why I said if you have a dentist who done you wrong, don't go back, find another dentist. Don't just quit on your teeth. Quit on the dentist, okay? I usually get numbed up. Yes, most people will get numbed up unless they prefer not to, which is some people do not want anesthesia. They're scared of the needle so much that they don't even want you to touch them. They want you to just do without it. Sometimes you can do that, sometimes you can't. What else causes them to have dental anxiety? Fear of pain. You just mentioned getting numb, but some people are scared of that needle. And me, when I'm doing my injections, I try to use topical to alleviate the pinch. I try to give them stress balls, turn on some music so that they can relax, especially if I have one of those people who are extremely anxious. And maybe we have to go into some other, nitrous or sedative to help them to relax so that we can fix the problem, because the toothache is going to be more pain than any dentist can really cause. I'm just being honest. Ask somebody, have you ever had a toothache? How bad did it hurt? Who in the chat has had a toothache? Worst pain of your life or nah? Some women say it's worse than having a baby, so, My night bots are tripping. My night bot said, you're starting to bug me. Please stop posting links. That is too funny. Another cause of dental anxiety is feeling of helplessness. So many people feel helpless with their teeth that they just don't even go. I have so many patients who step into the dental practice and they just like, it's bad, doc. It's so bad. They have talked themselves into believing they don't have no teeth left. They think it's so bad. And I do a full exam, educate them about their smile. And they're like, damn, I have a lot of teeth. I have something to fight for. Yes, you were about to count yourself out. Allow your teeth to get out of control. And if you catch your periodontal disease or gingivitis at a certain level, at least you stop it here. But if you never go and get it checked out, you just doomed. I'm telling you, you are doomed. You're doomed. And that's going to increase your feelings of helplessness. So don't feel helpless. You have so much that you can do. Other people have embarrassment from their dental health. Now, this might be one of the top reasons why people have dental anxiety. They have that embarrassment. They will only let a dentist that they trust in on their oral cavity, because it is one of those things that's very, very sensitive. People are very sensitive when it comes to their oral cavity. They don't play about that shit. They don't. And I understand. So that's why as dentists, we have to be very gentle, very understanding, and cater to the patient, especially if they experience dental anxiety. I never had a toothache. That is so good for you, Clifford 2000 fan. But I remember you told me that your mom instilled good oral hygiene 101 into you since you were young. So your mom, you got to really thank her for that, because a lot of people don't have that. That is such a blessing on her behalf to set you up like that. But when you come from hood to hood, when you come from the hood, a lot of people are not getting those lessons. I wasn't taught that lesson inside of the house. I was in maybe the 4th or 5th grade, and a dentist came to my school at Sable Palm Elementary in Tallahassee, Florida. I don't know who that dentist was, but they said, brush your teeth in circles. And I remember them telling me that. And I'm like, well, damn, I ain't never know that. Let me make sure I'm brushing my teeth in circles. They didn't tell us to floss, but at least I learned that. And I always listen. Toothache equal nerve pain. Yes, toothache is the worst nerve pain, because those tiny nerves somehow trigger a higher pain response in your brain. This Nightbot is on some dog shit. No drill, no quick fix for tooth decay. Yeah, no quick fix. Yeah, my Nightbot is tripping. The Nightbot is really tripping, and I don't know. I gotta fix that. I set something up like I got 2 bots going on at the same time, and one of them is kicking the other one out. And I didn't know it was gonna be like that, so I gotta fix that. But anywho, back to dental anxiety. Communication is key. Discuss your fears with your dentist. I already said that, but they can adjust their treatments and provide reassurance to make you more comfortable. Okay? So communicate with your dentist. Don't be afraid. Some people get in the dental office and they're scared. Hey, doc, I'm scared as hell. I need you to tell me so that I can properly do your treatment. But if you don't tell me, how can I know? Okay? Relaxation techniques can help you if you have dental anxiety. So practicing deep breathing, meditation, listening to music during your appointments can help alleviate that. So take your earphones, do some deep breathings, because if you work yourself up and you just, oh my God, I just can't do it, then you probably won't do it, and the dentist is going to send you running away. They're going to be like, oh, can't work on you because you're too anxious. Okay? Or they have to send you to someone else, or you just quit on yourself. Gradual exposure. Start with a simple checkup versus if you have a lot of issues and you notice, just go in for a checkup. Hey, doc, I don't want to do any work. I just want to know what's going on. Get the education first. See what's the most urgent issue and fix those issues. If you have some extractions, get those teeth out. Go to the oral surgeon, get them to put you to sleep, and just get that handled. Start baby steps. Gradual progression will get you to more involved procedures, and it can help build your trust and reduce your fear over time. As a dentist, I have patients who come in the first time and their anxiety is 100 out of 10. By that third or fourth or fifth appointment, they're like, dang, I don't have that same anxiety. That's because we have built a rapport and they trust me more. All right? So before we get off of here, I have a dental IQ test. I'm going to test your knowledge. Eventually, I wanted to set this up as a poll, but my poll wasn't working. So we're just going to do it via the chat. Y'all got it? Via the chat. So put your answers in the chat. I'll probably give y'all like a minute for each question. All right, so let's wrap it up with a quick quiz to test your dental knowledge. If you're ready, pump some hearts on whatever platform you're on and let me know that you're ready. So question number 1, how often should you replace your toothbrush? So A is every 3 months. B, every 6 months. C, once per year. Or D, when it looks worn. So how often should you replace your toothbrush? Every 3 months, 6 months, once per year, or when it looks worn? You got some answers coming through. Great answers. We got about 30 more seconds. Don't be shy. This is how we learn. How often should you replace your toothbrush? A, every 3 months. B, every 6 months. Or C, once a year. Great question. Great answers, guys. So it seems like everyone who is participating has answered. So you should replace your toothbrush every 3 months. Every 3 months. And here's a bonus. If you get sick, you get a cold, you get the flu, you get any type of virus, you want to replace your toothbrush after being sick. A lot of people never replace their toothbrush until it looks worn out. Okay? So every 3 months, replace your toothbrush. Question number 2. Which beverage is most harmful to your teeth? Is it A, water? Is it A, water? B, milk? C, soda? Or D, tea? Which beverage is most harmful to your teeth? You need me? Huh? You finna go? Oh, you finna go right now? What time they close? Oh, okay, I'm coming. Like 5 minutes.
You don't have to come if you want to.
Nah, come.
I'm gonna mess you up.
Nah, you ain't gonna mess me up.
Oh.
Great answers coming through the chat. Which beverage is most harmful to your teeth? Water?
Coca-Cola. That's what I would say.
Water, milk, soda, or tea?
Oh.
Great answers, guys.
Tea.
You think it's tea?
Hold up, say it again.
Which beverage is most harmful to your teeth?
Which one?
A, water. B, milk. C, soda. Or D, tea?
Oh. Soda.
You say soda?
Acid. I could say milk, but
What you say? What's your final answer?
I could say milk for the calcium.
I said more harmful though.
Water for fluoride.
That's helpful. Water don't have fluoride.
I mean, not fluoride. Definitely soda.
Okay, we got some good answers in the chat. Y'all was right. You already know we talk about soda, sweets. Very bad for your teeth. So eliminate the soda or you will get Mountain Dew mouth. All right?
Mountain Dew mouth. Can you do the do?
So, the next question is, what is the recommended amount of time to brush your teeth? What is the recommended amount of time to brush your teeth? And we definitely talked about this one. Is it A, 30 seconds? Is it B, 1 minute? Is it C, 2 minutes? Or is it D, 5 minutes? What is the recommended time to brush your teeth? This is one everyone should be pretty close to. We already know that it's not the first answer, 30 seconds. We know it's not that. Even though a lot of people brush for only 30 seconds, which is why I recommend the Oral-B IO toothbrush or some type of electric toothbrush that has a timer so that you can brush for I told y'all. Clifford 2000 fan, that is correct. 2 minutes. I thought I saw another 2 minutes come through somewhere. 2 minutes. Just 4 minutes out of your day just for brushing. If you add the flossing, that's going to be like 6 to 7 minutes. If you add the mouthwash, that's going to add another minute. So your whole oral hygiene routine should take about 10 to 15 minutes a day. And that's for 2 times. And that's for immaculate routine. The last question is a true or false question. And it is, gum disease can affect your overall health. Gum disease can affect your overall health. True or false? Can gum disease affect your overall health? True or false, chat? This is an easy one. Maybe. If you've been in this whole class, I talked about this a lot. We should definitely get this one. Gum disease can impact your overall health. I'm going to give y'all a minute. Who knows? Can gum disease impact your overall health? Clifford 2000 fan said true. Swift said true. I'll give y'all about 30 more seconds. Can gum disease impact your overall health? I feel so proud of the chat. You guys are awesome. That is correct. Gum disease can impact your overall health. So we talked about this from the beginning of the stream. It can impact your heart, your lungs. You know, it can have an impact if you have diabetes on all of your systems. So we want to make sure that we are brushing and flossing, guys. All right. Great job, chat. Y'all are so smart. I mean, the dental IQ is on 10. I am a proud professor today. I'm proud. So in closing thought, let's get some closing thoughts. Oral health is a vital component of overall well-being, okay? By understanding and implementing these 25 tips, you're taking a significant step towards a healthier life. Remember, your mouth is the gateway to your body, so take care of it. All right? All right, my Niji. So I got to get off of here. I have a meeting to get to, so I will holler at you guys maybe later today. I had no plans to come on here and do an oral hygiene 101, but I felt like it was needed. I had so many people requesting oral hygiene knowledge, so I wanted to get on here and do something specifically for that. So thank you guys for joining me. Thank you for making the chat so lit. I don't even know what's going on with my night bots, but they working overtime and doing too much, but we're gonna fix that, chat. So thank y'all for bearing with me as we are on this consistency challenge. We are on day 7 of a 365-day consistency challenge. Make sure you are subscribed. Make sure you go to download Twitch and give me those 10 followers, and we will continue to pump out more knowledge for the Hood to Hooded podcast. I really appreciate you guys, and I am out of here. Any last minute comments? Swift said, you inspired me to get back to my dentist, and that is my goal accomplished. All right, so y'all have a wonderful, wonderful Sunday. This is Dr. Cheapest Sunflower, and I am out of here. See y'all later.